A scene script. Is it true that infertility is mostly a woman's problem? Let's find out. Welcome to our journey into the world of male fertility. You may have heard a fair share of myths and misconceptions about this subject. One of the most common is the belief that infertility is primarily a woman's issue. However, this is simply not true. Indeed, around 1/3 of infertility cases are due to male factors. This means that in about 13 out of every 100 couples struggling to conceive, the problem can be traced back to the man. Another myth that's been making rounds is that age doesn't affect male fertility. While it's true that men continue to produce sperm throughout their lives, the quality and quantity of the sperm can decline with age. This can make it harder for their partner to get pregnant. Then, there's the misconception that lifestyle choices don't impact fertility. In reality, habits such as smoking, excessive alcohol consumption, and drug use, as well as certain medications, can negatively affect sperm production. Even factors like stress and obesity can play a role in male infertility. And let's not forget the myth that a man's fertility is only about sperm count. Although a healthy sperm count is crucial, it's not the whole story. The shape and movement of the sperm, often referred to as sperm morphology and motility, are also important. Even with a high sperm count, issues with morphology or motility can lead to fertility problems. Finally, there's the mistaken belief that men can't do anything to improve their fertility. In fact, changes in lifestyle, diet, and exercise can all have positive effects on a man's fertility health. So let's bust these myths wide open. Male infertility is a complex issue, and it's not just a woman's problem or about high sperm counts. It's about the overall health and functionality of the male reproductive system. So, infertility affects both men and women. Let's delve into how the male reproductive system works. Every man's body is a small factory, constantly producing tiny cells called sperm. This process of sperm production, or spermatogenesis, is a complex dance of biology that happens within the testicles. Think of the testicles as the production floor in our factory analogy, where the raw material, in this case cells called spermatogonia, are transformed into the finished product, sperm. But the process doesn't stop there. The sperm, once created, need to be stored and matured, and this happens in a tube located behind each testicle, known as the epididymis. It's like a quality control and packaging section of our factory, where the sperm are prepared for their eventual journey. Now, when the moment of ejaculation arrives, the sperm are not alone. They mix with fluid from the prostate and seminal vesicles. This combination forms semen, the vehicle that carries the sperm on their mission. It's like the delivery truck in our factory analogy, transporting the goods to their destination. Why is this process so important? Well, male fertility hinges on the body's ability to produce normal sperm and deliver them effectively. And this journey is no small feat. The sperm have to travel from the testicles through the epididymis, mix with the seminal fluid to form semen, and then travel through the urethra and out of the penis. But the journey doesn't stop there. After ejaculation, the sperm must navigate the female partner's vagina, pass through her cervix into her uterus, and finally reach her fallopian tubes. It is here in the fallopian tubes that a sperm might meet an egg and fertilization can occur. This complex process is tightly regulated by hormones and requires the right environmental conditions. It's a delicate balance, and when it works, it's a testament to the marvel of human biology. Now that we understand the journey of sperm, let's explore what could go wrong. Because like any factory, disruptions in the process can lead to problems with the product. In the case of sperm production, these disruptions can lead to male infertility, a subject we'll delve into in our next scene. A lot of factors need to align for a man to be fertile. When they don't, we encounter problems. For a man to successfully father a child, his body needs to produce healthy sperm, which should then be delivered to the woman's body. However, several factors can disrupt this process, leading to male infertility. One of the common causes of male infertility is sperm disorders. These are issues that affect the growth and development of sperm cells. A man might produce sperm that are oddly shaped, do not move correctly, or are not fully grown. In some cases, the production of sperm might be lower than normal, a condition known as oligospermia. In extreme cases, a man might not produce sperm at all, a condition referred to as azoospermia. These sperm problems can be inherited or be caused by lifestyle choices such as smoking, drinking alcohol, and taking certain medications. Another cause of male infertility is varicocele. These are swollen veins in the scrotum that can interfere with sperm production and quality. Varicoceles are similar to varicose veins that some people have in their legs. Retrograde ejaculation is also a cause of male infertility. This condition occurs when semen enters the bladder instead of coming out through the penis during orgasm. This can be caused by various health conditions, including diabetes, spinal injuries, and surgeries of the bladder, prostate, or urethra. Immunologic infertility is another cause of male infertility. This happens when a man's immune system mistakenly targets sperm cells, treating them as if they were foreign invaders. Obstructions in the tubes that carry sperm can also lead to male infertility. About 4 in every 10 men with a total lack of sperm, or azoospermia, have an obstruction or blockage within these tubes. Furthermore, hormonal imbalances and certain medications can affect a man's fertility. Hormones play a crucial role in the production of sperm, and any imbalance can disrupt this process. Certain medications, particularly those used for cancer treatments, can also affect sperm production and fertility. These are just a few of the factors that could lead to male infertility. Let's look at sperm disorders in more detail. When it comes to male infertility, sperm disorders are the usual suspects. They're the small, often overlooked culprits that can create a big stir in a man's fertility. And these disorders come in various forms. Let's take a closer look at them. Firstly, we have oligospermia, a condition where the body produces a low number of sperm. Picture it like a lottery draw. The more tickets you have, the higher your chances of winning. Similarly, the more sperm produced, the higher the chance of successful fertilization. But when the numbers are low, the odds are not in your favor. Then we have azoospermia. This is when no sperm are produced at all. It's like showing up for the lottery draw, but you forgot to buy a ticket. No ticket, no chance of winning, no sperm, no chance of fertilization. Now let's talk about the shape and movement of sperm. Some sperm may be oddly shaped or may not move the right way. Think of it as a marathon. The sperm are the runners, and the egg is the finish line. If the runners are not in good shape or can't run straight, they'll have a hard time reaching the finish line. And what do lifestyle choices have to do with all of this? Well, quite a lot, actually. Unhealthy habits like smoking and drinking can negatively affect sperm count. It's like trying to run a marathon while smoking a pack of cigarettes. Not only will it be harder to reach the finish line, but the number of runners may also decrease. Taking certain medications, suffering from long-term illnesses, or having hormone imbalances can also lower sperm numbers. The reproductive system can also suffer damage from childhood infections or blockages in the tubes that transport sperm, further complicating fertility. Sperm disorders can significantly impact fertility, but what can we do about it? Stay tuned as we delve into the diagnosis and treatment options in our next scene. Understanding the problem is the first step towards finding a solution, because when it comes to fertility, every sperm counts. Facing infertility can be daunting, but the good news is there are ways to diagnose and treat it. The first step to understanding male infertility is a comprehensive evaluation. This begins with a detailed medical history and physical examination. The doctor will want to know about any genetic disorders, chronic health problems, illnesses, injuries, or surgeries that may affect fertility. Lifestyle factors such as smoking, alcohol consumption, and drug use can also impact fertility and will be discussed. The next step is semen analysis. This test evaluates the number, shape, and movement of sperm. It's like a report card for a man's reproductive health. If the results are abnormal, the test may be repeated, and additional tests may be recommended. One of these tests could be a hormone evaluation. Hormones play a critical role in the production of sperm. The doctor may order blood tests to measure hormone levels and identify any imbalances. In some cases, genetic testing may be recommended. Certain genetic disorders can cause male infertility by affecting sperm production or function. Genetic tests can help identify these conditions. Once a diagnosis is made, treatment options can be discussed. The treatment for male infertility depends on the underlying cause. It could be as simple as making lifestyle changes or taking medication. For example, antibiotics can treat infections that affect sperm count. Hormone treatments can address imbalances that impact sperm production. In certain cases, minor surgery may be required. For instance, a varicocele, which is a swelling of the veins that drain the testicle, can be corrected with surgery. Assisted reproductive techniques are another option. These methods help sperm get closer to the egg, and they include treatments like intrauterine insemination and in vitro fertilization. Remember, seeking help early can improve the chances of successful treatment and conception. Don't let myths and misconceptions hold you back.